Hello, I'm Sarah Ketchum with the Newport News Police Department's Public Information Office. This is the Arrested Minds podcast, where we're having conversations about mental health. Obsessive Compulsive Disorder, or OCD, is an anxiety condition characterized by recurrent, unreasonable thoughts and obsessions that become so consuming they interfere with daily life. There are multiple categories of OCD, including contamination, checking, symmetry, and hoarding. OCD was once believed to be a standalone mental illness, but growing research shows a strong link to trauma. For someone who already has the condition, stress or a transition may worsen symptoms. Joining me today is Lieutenant Howser, who suffers from contamination OCD.
Hi.
Lieutenant Howser, I understand there were a couple of incidents during your career that stand out to you as turning points for your condition. Can you tell us what happened?
Yes. Well, just basically the overall stress of law enforcement in general kind of pushed me in a direction. One of the first instances that I remember being on the police department, and I'll never forget it, was I responded to a homicide out in Aqueduct Apartments when I was working on patrol in North Precinct. Call came out for a shooting. It was a young man that I ended up locating in a hallway. The young man was there. I opened the door and observed him laying in a pool of blood, and he was begging me for help. I knew, based on the injuries that he had from being shot, that it was a very critical wound, and believed that he probably was not going to make it. But it has always been something that's been in my mind and took me a long time. Still to this day, I can remember it and envision it. You know, his injuries were such that he probably could have been in the ER or the surgery ward at Riverside Hospital, and the doctors wouldn't have been able to save him. But just having that young man who's 17 years old beg for me to save his life, and watching someone die of a traumatic death was very tough. Those are stressors that police officers in general deal with on a somewhat regular basis, and some of them stick with you. After that, I started having trouble sleeping, thoughts that would, not necessarily just about that, but I really enjoyed my career. I was excited about my career. I started having difficulty getting to sleep because I was just up thinking about, I want to do this, I need to do this, a million different things. And obviously that homicide was one of the sticking points to where I didn't handle that stress well. And so what I did was I just continued to work and thought that work was my release and work was the way to get rid of stress. Well, in a sense it was, but it was a way to get my mind off of things and get my mind refocused. But at the same time, I was overworking myself and not dealing with the stress of the job. It was still compounding, and I wasn't dealing with it in a healthy way.
So did you realize at that time that you needed help?
I had some anxiety. I went to the doctor, and I ended up getting put on a anti-anxiety medication and a sleeping medication. Because one of the big things was I would get off work at 1 o'clock in the morning. I would have to be back at court at 9. At 1 o'clock in the morning, provided nothing happened and I had to stay over shift. So the doctor gave me something that was kind of like a prescription Benadryl, and gave me an SSRI for anxiety. And that helped for some time. But as I got my sleep pattern back, I ended up taking myself off of the anxiety medication for several different reasons. But one of the main reasons that I did was because I felt like, okay, I'm doing better. And there's always, and sometimes maybe it's more of a perceived stigma than it is actually a real stigma. But you feel weak having to take medication to control your anxiety. It was something for me that not only did I feel like I was doing better and didn't need it anymore, but at the same time, it was, I don't want to be on medication the rest of my life. I don't want to be, I don't want other people to know that I'm on anxiety medication. And, what are people going to think when I go to my city physical or something of that nature, and I'm on medication? They're going to think I'm weak, and I'm supposed to be a tough cop. So why would I continue to do that?
So then what happened?
Well, things were all right for a while. I still had problems with sleeping, but it was, as I said, getting to sleep and getting the things that had happened during that day or the plans that I had or what I was going to do the next day, and just the overall changing schedule of being in law enforcement, working evenings, then having to go to court, then maybe there was a meeting we had to attend, then I had to be right back to work. So all those things started to build up again. I didn't really realize that it was building up. I knew I was being sometimes short. There were some things that I realized that just kind of, I don't want to say a short fuse, because it wasn't, anger related. It was just frustration. It was little things would bother me. So that was really the first indication, and I didn't pick up on it. I didn't pay attention to it. I was just like, okay, it's just the job's frustrating. Job's stressful sometimes. Life is stressful sometimes. So I just kept working along until I had an incident. We had a drug dealer up north who I was familiar with. And this was probably the first time I realized that I had OCD. If I look back at everything, that it was something that was somewhat irrational, but at the same time caused me anxiety. We had a drug dealer up north. We arrested him. We knew he had drugs on him at the time. When we pulled him over, he decided to take a large bag of cocaine and put it into his mouth. And the bag was large enough to where he could not swallow it, but refused to spit it out. So we called medics, had him transported to the hospital. At the hospital, the doctor went over in extreme detail, and I believe it was probably to try and coax the guy to spit the drugs out, but what could happen to him if he didn't get rid of the drugs that were in his mouth. Started talking about how, it can make he could go into cardiac arrest, it could make his heart stop, and he was very, very detailed and graphic about it. And they ended up doing an x-ray. I mean, you could see, because he still wouldn't open his mouth, but he complied and got an x-ray done, and you could see the bag of cocaine sitting in his mouth. And as we were there, I guess he realized he couldn't swallow it, but he also didn't want to spit it out and get charged with it. So he began to chew on the bag, which caused the bag to rupture, of course, and which caused the cocaine to get into his system. This obviously started to have physical effects on him, which could be seen on the monitor. The doctors were very concerned, but at the same time, it wasn't to what they considered at that point life-threatening, so they could not force. He was still conscious, he was just uncooperative, so they couldn't force medical treatment on him. So it just became a sitting there monitoring him. Eventually, and as I said, the doctor was very descriptive about what could happen to you and how these things could absorb into your skin and cause damage to you. The individual eventually got to the point where he was vomiting, and he spit out some little chunks, and we collected those and told him, listen, it's the same charge. We've already got cocaine. It's the same charge whether you spit the bag out now or not. I think it was a several-hour process, and he eventually spit the bag out. That was the first time that I really realized. After that incident, I started wanting to avoid harsh chemicals. And, I mentioned cocaine. That's not something I was around outside of work, of course. But I thought about all the other, my mind kind of clicked, and I thought about all the other things that could cause harm or damage to me. If you read the back of a pipe cleaner, it's doom and gloom. I mean, I know it's the disclaimer, and they have to put on there that, it can harm you, it can cause cancer, it can kill you if, ingested, that kind of stuff. I know it's a disclaimer, but for someone with, eventually, after I was diagnosed with OCD, realized that, to me, that was like, okay, well, I don't want to deal with that. And it caused me physical symptoms of anxiety. Those physical symptoms of anxiety, the more I avoided chemicals and things of that nature, the worse my anxiety became. So I went to see a therapist. I didn't really want to. I waited a long time. But it got to the point where it was affecting me to the point I didn't want to come to work because I was going to be around stuff. I didn't really want to go anywhere. I didn't want to use household cleaners. I didn't want to be around people who were sick because I didn't want their germs to affect me and get me sick. So it eventually got to the point where it was affecting my job, where I would call out on a regular basis. So I went to a therapist, and that therapist, it was a psychologist, she diagnosed me with generalized anxiety disorder and panic disorder. The treatment for that was medications, which I had already decided I didn't want to get back on medication because that just made me weak and I didn't feel like I needed them. But it was affecting my daily life, so I wanted to get some techniques to be able to handle it better. The techniques for dealing with generalized anxiety disorder or panic disorder are relaxation techniques, breathing techniques, yoga, that kind of stuff. When you're in the moment of dealing with anxiety, especially when you're talking about OCD, the thoughts are still there, so the anxiety is still there. So breathing techniques, and it's really the avoidance of the item or whatever the contamination is that is causing you the anxiety. As long as you continue to avoid whatever the item is that's bothering you, the anxiety is still going to be there. You can do breathing techniques, you can do relaxation techniques, and they're good for relieving stress in general, and they're good for relieving stress related to panic disorder and anxiety disorder. For OCD, it's not necessarily the best course of treatment. Had the right direction of what I should be doing had I had generalized anxiety disorder or panic disorder, but it was the wrong diagnosis. So I continued, and I ended up going to see another therapist. That therapist immediately, as I talked to him and explained to him what was going on, he immediately diagnosed me with obsessive compulsive disorder. He said it's classic contamination excessive compulsive disorder, and you need cognitive behavioral therapy, which is slowly retraining your body to be accustomed to the things that are bothering you and causing you anxiety. Unfortunately, he was only able to see me once a week, and I was to the point where I was calling out of work almost every day, and it got to the point where I eventually went out on family medical leave. But when I went out on family medical leave, I realized that was kind of my low point, and I realized that I needed more intensive therapy than just every week I go and see this gentleman for an hour. So I've located a specialist in OCD cognitive behavioral therapy, and I went to see that person. The interesting thing is I realized all these fears that were causing me anxiety, and it was rationally in my mind. I sat there and I said, well, this is silly. This is why on earth. I'm a cop. I have chased bad guys, wrestled people with guns, gone into burning buildings, trying to rescue people. But at the same time, I'm afraid to use, or it's causing me anxiety, heart racing, sweating, things of that nature, to the point where I didn't want to leave my house thinking about strong chemicals, chemicals that could get on me and give me cancer or affect me in a certain way. And of course, the physical symptoms of anxiety increase with interaction with these products. So the first thing I learned was how important it is to find the right therapist. The therapist that I went to initially, I was misdiagnosed. That therapist taught me to relax, get away from the things that were bothering me and just try and relax. Obviously, when it comes to OCD, that's one of the worst things. I found out later that's one of the worst things you can do. It's kind of like if you have a phobia or fear of dogs for whatever reason. It could start out with a fear or an incident or a traumatic experience with a large dog where you were bit, and then turn into you're afraid of a chihuahua or a nice fluffy dog that somebody has walking down the street because you just avoid it, and your brain associates that little dog with the traumatic experience you had. Mine was more built up over time, and of course was exacerbated by the fact I refused to take the medication, and I continued to avoid the things that were bothering me. So I enrolled in, it was a more intensive program. It was an outpatient. I went to see the doctor several times, and he specialized in cognitive behavioral therapy. And gradually he exposed me to all these chemicals and things, and got back to the point where I wasn't having anxiety. And he also encouraged me to get back on the medication to make sure that it continued. And I just made the decision that regardless of what the stigma was, obviously it was something I needed in my life. My doctor was recommending it. I trusted this doctor. He had got me back to a place where I was getting ready to come back to work, and he said, this will keep it from blowing up again, from the stress that you have to deal with on a regular basis, from causing this to rear its ugly head. We all have our struggles. We all have medical conditions. This just happens to be mine. This just happens to be the one that I have to deal with on a daily basis.
So what else have you learned from this?
Well, it was very eye-opening. When we talked earlier about the stigma related to, or the perceived stigma related to having any kind of mental health problem. It was very eye-opening when I actually went out on FMLA and people kind of heard through the grapevine that I was having anxiety issues. It was amazing how many people in the department and outside, family, friends, and people that I didn't even know very well in the department, came to me or reached out to me or made a phone call and shared their story with me. That's part of my reason for coming today and sharing my story, is the department and the members of the department who you deal with on a regular basis every day may be dealing with a mental health issue that we know nothing about. And when you have anxiety or mental health, because of the stigmas surrounding that, you learn to hide it very well. It's not until you have something that people come to you and they tell you their story. It shows you're not alone in dealing with this. The amount of people that came to me and talked to me about the experiences they had with anxiety or depression or whatever their problem was, extremely eye-opening. The other thing was, I mentioned, you've got to find the right therapist and get the right diagnosis. There's nothing wrong with having to take medication, having to go and talk to someone about what's going on. Part of my problem was I waited so long because I wanted to be the tough guy, and I held out way too long. I should have gone and talked to a therapist a lot earlier, and it wouldn't have gotten to the point where it did. It may have not even gotten to the point where I had to take time off work. If I had been able to clearly identify what was going on, which is also why I said it's very important to have the proper diagnosis. There's a bunch of different therapists out there. If you go and visit a therapist, it's just like car dealers. You go to a car dealership and you don't like the cars that they have going on, or it's just not working out for you, well, there's another car dealership right down the street that may have exactly what you need. And in my case, that's what happened. I was misdiagnosed. It wasn't working for me. I went to another doctor, and that doctor clearly identified what I had immediately and put me on the right track to recovery. The other thing that I learned is I had to deal with the stress of this job in a healthy way. Coming to work to relieve stress is not the way to do it. Obviously, other people I know have struggled or turned to alcoholism or prescription drug use to manage their stress. Obviously, those are unhealthy ways of dealing with it as well. My unhealthy way was continuing to overwork myself. So one thing that I had to learn myself, and I had to learn that when I started to get cranky or things started to frustrate with me, I have to take time off and distance myself, just completely block out and give myself some free time, hunting, fishing, doing whatever I need to do, physical activity to just let my brain rest for a minute, just shut it off. And that is one thing that has helped me tremendously.
So are you cured?
So OCD is one of several mental illnesses, of course, anxiety in general, because it is somewhat associated with anxiety disorders. There is no cure. It's learning to manage it. When I first learned that, it was very disheartening to me. For when you have something ailing you and you go to a doctor and the doctor tells you, well, I can help you, but there's no cure for it. You're going to deal with this the rest of your life. So, of course, in that moment when I first met with him, it was kind of a hopeless feeling. And at times during my recovery, it was a hopeless feeling of, I'm never going to be able to get by this. I'm going to lose my career. I'm going to, everything that I've worked for so hard is going to go out of the window because this is something I can't cure myself of. The way I wasn't looking at it was, it's manageable. And it goes back to, you have to learn yourself. You have to learn what it is and be able to identify, okay, I'm overworking myself and I'm stressing myself out and little things are starting to bother me. I need to take a day off. I hate to use the word mental health day because, that's got people look at it and but at the same time, you have to take that time to yourself. We have a tendency here to, want to work overtime to make money. And I have to identify when I'm overworking myself and the stress is starting to get to me, and then deal with that stress in a healthy manner, and then just come back fresh. So over years, I've learned to do that. Am I cured? No. There will never be a cure, or there may be a cure one day down the road, but it's kind of like diabetes. I have to take medication for it every day, but it is something that someone with diabetes or other physical illness may have to take steps, take medication, go see the doctor to manage it for the rest of their life. I have learned over the years to deal with it, and this happened near the beginning of my career when I was a patrol officer in North Precinct. I've been here 15 years now, and I will tell you there have been times where it has come back and I've immediately recognized, okay, I'm starting to have some OCD thoughts. When COVID came out, for example, that was one time that I realized, okay, obviously COVID caused a lot of people to have anxiety, still does to this day. My immediate response as somebody with OCD is, well, I'm going to lock myself in the house and I'm not coming out. That, if I did that, would put me into what I call a spiral of, okay, well, yeah, I could still get COVID because my wife's going to work. She could come in, so what do I do? Lock myself in a room away from her? So the idea for me is I have to approach things that immediately give that, when my mind gives me that OCD response of, I want to get away from this, or it bothers me, or I start to feel a little anxiety over that. I have to think, okay, obviously this is irrational. I already know that. And I have to face that. If it causes me anxiety, it causes me anxiety. But if I avoid it, that's when I come into the problem. I have to walk through life thinking, okay, what would a normal person do in this situation, and do that. And then sometimes, as part of the therapy, you do exposures, not with COVID, but with other instances, like with the contamination worries about household cleaners and things like that. If I start to have a thought that I'm anxious about that and I want to avoid it, I got to go get a household cleaner and start cleaning the house. And that way, it teaches my body, okay, that was just a frightening thought. There's no legitimacy to it. And obviously, you're right, it's a irrational thought, and then you move forward. So while I have not been fully cured, I've learned to manage it, what I consider well over the years. I obviously came back to work and was able to continue my career as I eventually became a narcotics detective, where, we have people that during times like that, there's a very real risk in some of those. Fentanyl, for example, it's transdermal. You get that on you, you breathe it in, it could cause you problems. Obviously, for somebody with OCD, I wanted to avoid that, but I couldn't because of my job. So I was able to continue and work through that, get through my career, and have been promoted to sergeant lieutenant since then. So the one thing I'd like to just make sure that everybody is aware of is the stigma that you feel is there. There are a lot of people around here and in law enforcement in general who have mental health conditions, have anxiety, have problems dealing with the stress, and it's okay to talk to somebody. It's okay to take medication. Surprisingly, I thought, the department, when it happened, would look at it and say, maybe this is somebody we don't want as a police officer. It was the exact opposite. They were very supportive, the entire department. I can't think of anyone that I didn't hear anything about people saying anything bad. It was the exact opposite. People reaching out saying, hey, this is my story. You're not alone. I know what you're going through. This is what I did to help that. Back then we didn't have CISM. Now we have CISM. We have programs, people that you can talk to about these things. If you don't want to talk to CISM, talk to a therapist. Talk to someone, but do it early. Don't let yourself get to rock bottom before you seek help.